Welcome to another edition of the SABC News COVID-19 A Global Wrap. I am Babalole Phaka, and I will be bringing you highlights of stories which dominated news headlines with regards to the coronavirus pandemic. But before we delve into it, let us have a look at some global statistics. The world currently has over 156 million cases, with over 134 million recoveries and over 3.2 million deaths. South Africa has 1,590,370 cases, with 1,511,905 recoveries and 54,620 deaths. Staying in South Africa, the Transnet National Ports Authority says it is in the process of tracing those who may have been in contact with 14 Filipino crew members on board a ship in the Durban harbour who have tested positive for COVID-19. In a statement, the Ports Authority says that the vessel arrived from India on Sunday. This comes amid concerns around a COVID-19 infected traveller from India who recently entered South Africa. The case has sparked fears of a possible spread of the B1617 variant that is dominant in India. However, the National Institute for Communicable Diseases has assured South Africans that the variant has not yet been detected in the country. Meanwhile, Tourism Minister Mamoloko Kubai says any decision on travel restrictions to and from India amid a massive surge in coronavirus cases and deaths in that country will be guided by scientific evidence. On to the rest of Africa. The continent has over 4.6 million cases, with over 4.1 million recoveries and over 123,000 deaths. The World Health Organization Regional Office for Africa says there are vital lessons to learn from Africa's COVID-19 vaccination rollout, such as planning and preparation. 47 African countries are now rolling out COVID-19 vaccines, and over 17 million doses are given on the continent, with Angola, Ghana, Mauritius, and Rwanda making strong progress. In a statement, WHO Africa says nearly 40 African countries developed national vaccination plans before COVID-19 vaccines began arriving in bulk on the continent, many with support and guidance from the World Health Organization. Staying on vaccines, health experts say a combination of warnings about possible rare blood clots, the rubbishing of vaccines by some leaders, and mixed messages over expiry dates have all contributed to the slow rollout across the continent. COVID-19 has also not hit Africa's 1.3 billion people to the extent that it has ravaged some countries in Europe, Brazil, the United States, and India, hereby leaving some on the continent doubting the seriousness of the disease. However, the head of Africa's Centers for Disease Control and Prevention, John Nkengasong, again implored citizens to stay vigilant, calling India's COVID-19 disaster a wake-up call. Meanwhile, Kenya on Wednesday detected a variant of COVID-19 first diagnosed in India. The variant was detected in 5 Indians who arrived in the East African nation last week, just before Kenya banned flights to and from India. This comes days after the same variant was detected in neighboring Uganda. Tanzania has also suspended flights to and from India amid the COVID-19 surge, the latest sign of its increasingly active approach to tackling the pandemic under its new president. And finally, in Nigeria, the country announced a ban on travelers coming from India, Brazil, and Turkey because of concerns about the rampant spread of coronavirus in those countries. And in international news, United States President Joe Biden's administration announced that it will formally support a World Trade Organization waiver for vaccine intellectual property. U.S. Trade Representative Katherine Tai confirmed the announcement despite last-minute lobbying from Republican lawmakers for the administration not to back the proposals at the WTO. The proposal, led by India and South Africa, would waive the intellectual property rights of pharmaceutical companies to allow developing countries to produce COVID-19 vaccines. Tai added that making vaccines more widely available throughout the world is needed to end the coronavirus pandemic and foster economic recovery across the globe. In South America, Brazil's President Jair Bolsonaro has hit out at critics of malaria drug chloroquine as a COVID-19 treatment, questioning why people were against it. His comments come as a parliamentary inquiry is looking into the handling of the pandemic that has killed more than 417,000 Brazilians. In Asia, India's deteriorating COVID-19 crisis saw the country reporting a record 412,262 new COVID-19 cases on Thursday and a record 3,980 daily death toll. India's tally of coronavirus infections surged past 20 million on Tuesday, becoming the world's second nation after the United States to pass the grim milestone. With hospitals running out of beds and oxygen, morgues and crematoria overflowing, experts say the actual numbers could be 5 to 10 times higher. India's surge has coincided with a dramatic drop in vaccinations due to supply and delivery problems. With the world's biggest vaccine-making capacity, the country has partially or fully immunized only 9.5% of its 1.35 billion people, according to the government's CoWIN portal. And finally, in Europe, European Commission President Ursula von der Leyen says the European Union is willing to discuss a proposal to waive intellectual property rights for COVID-19 vaccines. Von der Leyen said the bloc's vaccination effort was accelerating, with 30 Europeans being inoculated per second, while exporting more than 200 million vaccine doses to the rest of the world.
For the latest updates on the coronavirus, visit sabcnews.com.